Hello everyone. Our work is about blood neutrophil to lymphocyte ratio as a predictor of survival in amyotrophic lateral sclerosis. ALS is a progressive and fatal neurodegenerative disorder in which the diagnosis can be difficult and slow. There are evidence that inflammatory processes are intensified in neurodegenerative diseases, such as ALS. The identification of easy accessible biomarker predictive of disease outcome would facilitate disease management and permit an appropriate prognosis stratification in clinical trials. The neutrophil to lymphocyte ratio is a great example of a dynamic relationship between innate and adaptive cellular immune response during illness and various pathological stages. NLR is not only described as a reliable but also economic marker. It is considered a robust prognosis biomarker for predicting patient survival outcomes in various diseases. Therefore, with this study, we aimed to evaluate the impact of this potential inflammatory biomarker in the survival rate of ALS patients. To do so, we included data from 274 ALS patients followed in our center. Patients were clinically evaluated at the time of blood sampling and longitudinally thereafter, applying the revised ALS functional rating scale. Standard respiratory function tests were also performed in these patients in order to evaluate not only the functional but also the respiratory progression of the disease. Neutrophil and lymphocyte parameters were quantified from a standard complete blood count, and the NLR was calculated as the ratio of the neutrophil count to the lymphocyte count. These parameters were then correlated with clinical variables, and its values explored as an indicator of survival applying Cox regressions. Based on this, high NLR levels were associated with a higher survival rate. This positive association significantly shows the potential predictor NLR could be in the survival of ALS patients. However, by multiple regression, NLR had no statistical significant correlation with ALS rate of decline and respiratory decline. Although covariables such as age, gender, and phenotype had no influence in this result, it is important to evaluate these parameters in different time points and disease stages, making it possible to better understand the function behind immune response in pathomechanisms of ALS. NLR is a novel methodological parameter for systemic inflammation, being used as a reliable and cheap marker of ALS-related prognosis. In this sense, we have found promising results suggesting that NLR could represent a reliable predictor of ALS survival in our population. An elevated baseline NLR is a useful and easy accessible indicator for short survival duration in ALS patients. Further studies involving serial measurements in a larger number of patients deserve an intensive investigation in ALS. Thank you very much for your attention.